So the question was, somebody who has maybe early symptoms or signs of lupus, what can you do? Just controlling the symptom is not good because you're not asking what's the cause of the inflammation.
Right.
Because lupus generally attacks the joints, but it can attack almost any part of the body. Case in point, I think, if I'm not mistaken, one of the Williams sisters, the tennis player, had lupus or sarcoids.
Yeah.
But the point is that it attacks joints, it can attack the lungs, it can attack any organ in the body, but joint is predominant. And if you don't ask the question why, then you'll never be able to fix it. What you'll do is just use immunosuppressant medication to reduce the inflammation, which itself has side effects.
Like
but then, you're not really fixing the problem. So, you can probably stop the joint from being destroyed, but you've got to really look at if the immune system is being provoked like that, then what else is it doing?
Right.
Above and beyond what's visible. So generally what we say is that this is under the umbrella of autoimmune disease. So I'll start with simple ones that people often are familiar with. Thyroid is an autoimmune disease for the majority of the conditions, right? So that's one of those. Kids with diabetes type 1, that's an autoimmune disease. So there's a lot of autoimmune there. Today I just had a friend of mine who I see in the gym, really fit guy, and he never has any joint problems or anything. I'm like you go, you're still working out real heavy, strong guy, and so it almost seems like nothing's going to affect him. He sends me a photo of his skin around his hands and around his arm. He's saying, I've got this rash. What type of doctor? And I looked at it, I said, that's vitiligo. That's autoimmune.
Yeah.
Where you lose pigmentation. So
Right.
so when you have your immune system, which means antibodies attacking the thyroid, you'll destroy the thyroid. When you have immune cells attacking the insulin in your pancreas, you'll destroy the pancreas. When you have immune cells attacking the melanocytes, you'll destroy the pigment, which is pale. So I said, it looks benign, but you may want to find out what's causing your immune system to attack it, because it's not uncommon for me to find people with things like this 10 years later having another problem. So I had somebody with psoriasis, just a skin problem. Then he got Wegener's granulomatosis, which is a really severe condition of lung and kidney problem. So I would say that anything that irritates the immune system should be nipped in the bud, because you do not want to take a chance with the immune system, because it's powerful at killing off parasites, viruses, bacteria, cancer, but it's also powerful at turning on you. That's what's called autoimmune. It turns on you. So you must ask the question, why is your immune system turning on yourself? Now, so you look at the inflammation that comes from food, coloring, chemicals, additives. You look at the systems that ordinarily support your immune system, like the liver. Where's the glutathione level? Things that damage the defense mechanisms, like inflammation, you got to identify it. If it's there, turn it off. So that's why it's important that when you got somebody in the early stages of anything, particularly an autoimmune disease or something like a lupus, it's important to turn it off. Find out the root cause. Even something like a vitiligo, which is just coloration. Of course, if it's in the face, people will be very worried about it, but they are easily, inclined to just let it go. And whether it's a psoriasis, a little bit of skin problem, or a pigmentation problem, you've got to just really be, I suppose an experienced doctor would understand that at the very least. That these are simple to you, but they're alarm bells for me.